Welcome, ladies and gentlemen, back to the program. Our next guest this morning is the Senior Science Advisor to the Men's Health Network. He's a past chair emeritus of the American Public Health Association, former Alumni Association board member of Columbia University School of Public Health. His name is Dr. Salvatore Giorgianni. And welcome, Sal. How are you?
Good morning. Thanks for having me on your show.
Absolutely. Glad to have you. Glad to meet you, sir. So first off, I want to get into some prescription talks about prescription drugs and everything else, because I know that you are, you know a lot about this subject. But first, What is the Men's Health Network? What's that all about? How'd you get involved with that?
It's a part of my volunteer work. I really firmly believe that men and boys in America don't really have access to as much information, education, advocacy about their health. So the Men's Health Network, I've been working with them for almost 15 years now, and we are the oldest and largest not-for-profit association that deals with the health and welfare of boys and men and their families. Our slogan is that we bring health care to where men live, work, play, and play. So we're very active. We have a website that's just full of a lot of great information at www.themenshealthnetwork.org, and there's a lot of the information we'll talk about today and more on that website for folks to go to.
So when I have this headline here, Donald Trump says Pelosi's promise to work with him on drug prices, the drug price issue is camouflage. Can anything actually be done on this issue? I mean, the Democrats are trying to impeach the president. I mean, what's up with that?
Well, I'd rather not comment on the impeachment business, but I do think that they're getting bogged down in Congress in a political show that's a lead up to the 2020 election. And unfortunately, as so often happens with these things, the real work of the people doesn't get done in Congress. And, Americans really do need to have ways to better manage the price of medications, the cost of medications to them. And Men's Health Network really does believe that appropriate methods to help manage those costs are the right thing to do for people. We know that for men, for anyone really, for men and boys, if you increase the copays for medications, the utilization and the compliance, taking it regularly as prescribed, tends to go down as the costs, out-of-pocket costs go up. So when we looked at the issues that are being tossed about and discussed both by Congress and the administration and many, many others, we do think that there are some things that can be done to help bring some rationality to addressing these cost issues.
Well, I mean, here's the thing. I think a lot of people, the line between insurance companies and government, and pharmaceutical company, I mean, it's getting blurrier and blurrier. It's almost like they're just the same entity at this point, right? I mean, and that's why it's hard, I think. And a lot of people just feel like healthcare is just such a racket. I know down here in Arkansas, I mean, it really has kind of become really less and less about the patient and just more and more about, supporting a bureaucracy, really.
You're absolutely right there. In fact, most everybody, 99.7%, I suppose is the way to say it, of everybody who has prescriptions filled has them managed by companies, for-profit companies called pharmacy benefit management companies. Increasingly, these, we call them PBMs for short, increasingly these PBMs are one side of the same coin with insurance companies. They have very deep and complex, intertangling relationships, and some actually of these PBMs own insurance companies, health insurance companies, amazingly enough to me. And I've been in pharmacy long enough to know when these PBMs weren't around, and then they came into play to help smooth out the reimbursement issues and help people afford their medications. And they went down, I think, a great path to help purchase medications based on volume contracts and sustainable contracts. And then they got into this notion of rebates on what is used. And all along the way, since the 70s, the late 70s, when these PBMs came into influence in this market, the whole concept was that any rebates or any money savings should go back to the patient in the form of reduced out-of-pocket expenses. And when Men's Health Network looked at it, we found a very mysterious, a very overly complex system where the money didn't seem to be going back to the patients. It seemed to be going back primarily to the PBMs and their insurance companies. And we think that's really wrong-minded.
Yeah, and everything gets passed on to the consumer in this case as well, which translates to higher drug prices. So what do you think can be done? I mean, I'm kind of assuming that Congress is actually they're just not going to be able to function at this point because they can't really
for a while.
But what could be done if we did have a Congress that was actually willing to work on behalf of the American people?
Well, I am a little concerned though that there are things going on in background, and the push by the American public to do something on price controls could give Ms. Pelosi, who is famous for her Affordable Care Act, quote, we've got to pass the legislation before we can see what's in the legislation, to push something through under the radar, if you will, while all the dangly light things on this impeachment situation are being reviewed. So I do think we have to remain vigilant. But Men's Health Network has put out 5 principles we think should be considered when they're looking at the legislation or regulation. And that they have to prioritize straightforward and effective reforms. The system's already too complex. People don't have confidence in it, as you said earlier. Ensure that any cost reductions are passed right back to the patients. They don't go back into insurance companies, that it's transparent about what happens with all of these contracts and negotiations. The money is trackable back to the patients to lower copays. We think that access to care needs to be maintained, that people need to get their medications. Formulary management or the management of the list of medications that a person can get should not have draconian or difficult limits put on them, such as step therapy and other things that limit the access to good treatments. We firmly believe, and this is one of Men's Health Network's firm tenets, is that you need to maintain the provider-patient relationship, that for-profit companies in the insurance sector should not be making the rules by which physicians, nurse practitioners, and PAs practice in the best interest of the patient. We don't feel that's an appropriate position to take. And then the last one goes to a lot of the rhetoric we hear, which is allow free markets, not government mandates, to control costs. We do believe that the best way to control costs in the health sector, prescriptions, access, hospital, whatever it might be, is to have open, transparent, good old-fashioned American negotiations, not government price setting, not arbitration boards, not bureaucracy deciding what you can charge for medication, but good negotiation.
Well, yeah, we've heard of the story of like the $100 aspirin. I mean, it has a cost. I mean, this is what hospitals, they report their uncompensated care. We call it hospital math down here. And it's just, it's a joke. They go to the government, uncompensated care. It's like, wait a second, you're claiming that it's a loss, and you're inflating your loss numbers for what it actually costs, and that's really frustrating. I want to ask you another question. We're talking with Dr. Sal Giorgianni Jr., and he is with Men's Health Network, a senior science advisor for them. So I don't know how long ago this was, Dr. Sal, but I think it was, maybe it might have been as long as 6 months ago at this point. But the president announced something. President Trump announced that he wanted transparency in pricing with insurance companies and hospitals. And when he did that, their stocks went down. And I thought, I think we may be onto something here. So, I mean, it kind of goes to what you're saying of, we've got to be transparent. We need them to show us what their prices actually are. instead of what they may be, depending on which insurance company we're dealing with.
Yeah, we would tend to agree that transparency and restoring trust in the system, you said earlier, a mouthful when you said that it's too complex and people don't trust the system, and that's a difficult position to be in with something as important as healthcare, which touches people at risk of significant health issues and dying. You know, people really need to understand what's going on. So I do think that transparency is appropriate. There's a fine line between being transparent in costs and pricing and being intrusive in innovation, and that's one of the other things that we really do think has to be guarded against, whether you're talking about diagnostic technology, health surgeries, or medications, or anything else in the healthcare sector. You really do need to be able to provide good and appropriate rewards for investments in the tremendous cost it takes to bring these technologies to market.
What are your thoughts about the pharmaceutical industry in general right now? I mean, are there reforms that need to be made there as well?
Yeah, they are the we like to say they're the entity you love to hate. You know, they're so important because almost 70% of every medical encounter results in a prescription. And prescriptions really have made a huge difference, or medications have made a huge difference in longevity. So they bring an awful lot of good when you look at the reductions now in the survivability of cancer, when you look at the reduction in heart deaths due to heart rate. It's still high, but, you know, it's much, much better than it was when I was training, back in the 70s in New York City. So the technology is there, but I do think the pharmaceutical industry is being asked to address more and more difficult targets in terms of what disease conditions they're looking to bring medications for. So no business entity is perfect. I don't think you give them a pass every time, but I do think we have to acknowledge the fact that they are heavily regulated, that the cost of bringing a new drug to market is pretty darn high, like $2 billion last time I looked, which is about the same cost as shooting off a rocket ship or a spaceship.
Yeah.
But I do think they need to be circumspect about their pricing and costs, but that can't be at the expense of encouraging them to bring new technologies for more and more difficult and more high death rate type medical conditions.
Dr. Salvatore Giorgianni, Jr., we appreciate you being on the program this morning and educating us, enlightening us. I really appreciate the conversation. I'd like to do it again sometime and, continue this discussion, because I think that's how we got to get these ideas out there. So.
Yeah, and when it comes up again in Congress and they're actually ready to do something that we can see, we can talk again.
That sounds good. I appreciate it, sir.
Thanks for having me on.
Thanks so much. Yes, sir, Sal. All right, we're going to take a break, folks.